Good morning, everybody. And first and foremost, I do want to thank the people that are on the front lines doing their job day in, day out, so people can stay home safe. So thank you for what you're doing. Thank you for everyone keeping our county moving in the right direction. You know, sadly, I have to report 2 more people passed away over the course of the last 2 days. We just got the numbers in. And 2 people in their 80s, both males with underlying health conditions, and unfortunately, it was at our Shaker Place nursing home. So, you know, I went out there this morning and met with some of the workers, and we talked, and it's not easy. They have a tough job. And if you see what's going on at national level, it's not easy. It's not easy for the people out there. But the workers are so dedicated to the people living there, as well as their families, making sure they're getting the great care that they're entitled to. My heart goes out to the families, my condolences, and unfortunately this brings us up to 25. Regardless that these people were getting health care for end of care life, it doesn't matter. We still don't like this to happen. Rest assured, you know, we're doing everything in our power to not have the national trend that you see on a national level with nursing homes and what's happening downstate. So I want to thank the workers out there for their dedication. I want to thank the director and everyone else doing everything in their means to protect the people, which makes it tough. So as this morning, we have 678 positive cases, up 22 from yesterday. We have 754 people under mandatory quarantine, down 30 from yesterday. And we have 41 people under precautionary quarantine, up 11. At our nursing home, because we've been aggressively testing and making sure that, you know, we're staying on top of this issue, we have a total now, we went up for 22 residents that were tested positive for the COVID-19. Up 1 employee, so now we have a total of 10 employees, 9 that have it, 1 that's recovered and back to work. We have 30 people hospitalized with a hospitalization rate of 4.42%. That's down from yesterday at 5.34. Still have 9 adults in the ICU, and we're entering the 6 weeks of this now. I want to put a reminder out there that we have our mobile site testing that are up by appointments only. I know there's some issues. I talked to some council members and legislators in the city that people are having a hard time getting through, so please, we're working on that to make sure that's not an issue going forward. But also today's the day, and I guess I don't know if I clarified it yesterday, today's the day that you can sign up for the Rite Aid starting tomorrow on Colony sites. So that number is area code 518-465-4771. That's for the mobile site testing that are by appointment only. In the Colony Rite Aid, that was for our mobile site. The Colony Rite Aid, you can go to www.riteaid.com for the drive-through. That's up as of this morning. I did not check it, but I believe it's up and running right now. So please do that now. I know people went there yesterday and could not get through because it was not up. You know, as we gather to get all the information that we can and to identify what areas this is affecting more, or backgrounds on people with underlying health conditions and everything else like that, I know there's been a lot of push from people that they want to see a website. They want to see where the numbers are at. They want to see what areas are affected versus not. And, you know, they want to know the numbers. And I get all that. They want a peace of mind because the world's changed. And I continue to remind people that, it's here. It's here. It's in our community. We slowed it up by staying home and by most of the people in this county doing the right thing. We slowed it up. And with the leadership of Governor Cuomo and his team, we slowed it up. By wearing masks out in public, we slowed it up. By not going outside and having parties or continue to gather in mass gatherings, we slowed it up. It doesn't mean it's gone. It doesn't mean because our numbers are kind of like a little low and hospital rates are low that it's not there. I do want to say to people that are watching this, please, by all means, if you're sick, go to the hospital. Don't stay home. I don't want to share a story of something that happened personally in my family that the person didn't go to the hospital and what the outcome was. It's not good, people. Go to the hospital. If you're sick, you got chest pains, you got some issue going on, go. Because a lot of people are staying home. I don't know if you read the New York Post, New York Times. There's stories, Times Unions. There's been stories about this. People staying home and record people dying at home because they're afraid to go to the hospital. Don't be. They were trying to stop people that didn't need to go to the emergency rooms to seek their doctors out so they didn't bottleneck their ERs. But that's not the case if you have an underlying condition. Don't be scared to go to the hospital. So as we gather more information, how many people have the virus, and we get a better picture of what's going on and we're dealing with, I still will remind everyone to absolutely, it's critical that we social isolate. So today, we're launching our website that's behind my left shoulder. And we're going to be going through the different graphs. I'll go through a couple of them, and then I will turn it over to the expert, Dr. Whalen and her team, who put it together. But there's a few things I want to point out about the website. We do include the daily briefings, the hospitalization, the positive cases by zip code, and gender and ethnic background in the positive cases. So if you look, I do want to show this, the positive cases, and I know Dr. Whalen will get more into this, and I'll let her talk about it. The 661, and then it breaks it down from the first case that we had to today, but it also has the map where you can press different areas on the map, and you can go to Altamont, counts 14 in Altamont. You can go to, well, we don't want Schenectady County. We can go to Albany, and that zip code, 12203, the zip code is 81. And if you go into another part of Albany, where I live in the zip code of 12208, there's a count of 61. So it breaks it down there. But what was alarming to me, and I'll have Dr. Whalen talk more about it, was if you look at the age groups, because the kids out there that don't think this is going to happen to them, if you look at the age groups, which is alarming, 20 to 29-year-olds versus 60 to 69. The 20 to 29-year-olds higher for positive rate versus the 60-year-olds. So, which we want to point out to people, in the 50 to 59 is the highest. So, as we saw on a national level, it was more, everyone kept saying over 60, underlying health conditions, it affects you more. It's not the truth. This thing changes and you get different opinions, and I'm not here to be a doctor, and I'll leave that to Dr. Whalen to talk about the statistics. But you look at the breakdown too. More females than males. And this is just Albany County, so I'm not talking at the data across the state of New York. This is just here in Albany County. More females at 52% of the rate versus 48, and then you break down the background. Weights are at 47%, African Americans are at 20, others at 12, unknowns at 7, Hispanics at 7%, and Asians at 7%. The mobile testing sites that we set up in these areas, in areas where people can't get transportation, was crucial, but it's only been 1 week. So as the coming weeks go forward and we continue to test more, these numbers will probably change. It will be updated. It won't be updated. We'll try to update it daily, but there's going to be times that it's going to be a little bit behind, but we'll try to keep it updated for everyone. And again, the other crucial number is we've tested 7,135 people, 687 were positive, and that's a result of 9.60% of persons tested. So that's something really crucial to talk about. But these are the thing I want to highlight. And if any of these young kids at home who want to get outside, look at your age, 20 to 29, higher than someone in 60. Think about that. That's why I want you to take away, and then the interactive map. But I'll let Dr. Whalen break down the statistics because you're better than I am at it. Dr. Whalen.
Thank you so much. Can you guys hear me? Okay, before I talk about the new data that we are sharing with all of you today, I wanted to just address a couple of things. First of all, for Shaker Place, I have said previously at press conferences that the nursing homes are under the domain of the State Health Department, and that is the truth, but we follow along on all cases that are reported for Albany County, and we have been working closely with them. I want to state that from the beginning, the nursing homes, as you know, had a mandate for people to wear masks, and Shaker Place in particular was very rigorous about what they needed to do to control infection within their doors. Unfortunately, we are seeing this not only in Albany but across the country, that our nursing homes do contain our most vulnerable residents, and unfortunately, when there is COVID-19 in a nursing home, it is likely that the outcomes won't be as good as they are in the communities. We have been in touch with them and are aware that they are doing appropriate control measures, including what's called cohorting patients, so making sure that COVID and non-COVID residents are appropriately separated. And we are also ensuring that healthcare workers that are caring for individuals with COVID have the appropriate PPE. So the mandate had previously ensured that everybody was wearing a surgical masks, and we are going to be assisting with some fit testing, which is necessary for the N95 masks that will be necessary. So I want to say this to ensure that everything is being done by the nursing home that can be done to stem this going forward. And they have been very proactive. All our nursing homes are being proactive, but unfortunately, as I said, these are vulnerable communities that we are being seen hit across the country. The second thing I want to talk about just for a minute before I talk about the data is I wanted to echo the county executive sentiment about the importance of receiving urgent care in hospitals. We are hearing from our hospitals across the county that their census are down, that their numbers that they normally would see for cardiac events like heart attacks or strokes or other problems are not what they normally are. I want to reassure people that the hospital is still the best place to get care. What we don't want to happen is while we are controlling one public health problem to develop another one. The health department is committed as well to monitoring issues related to chronic diseases like heart disease, lung disease, kidney disease. If you have an underlying condition and you are experiencing symptoms that require you to be seen in a hospital emergency department, go to the hospital emergency department. You will receive the best care. Please do not try to tough things out at home. The hospital is still the best place for care. So with that, I am now going to talk a little bit more about, let's see if this comes out. There we go. Talk about this data here. So a word before I start talking about the data, there's a lag. So the numbers that we gave you today are not going to be the same as the numbers that you see here. These will be updated in the evening and they will be refreshed overnight. So in the morning you will have the results that we probably shared with you this morning in terms of numbers. We talk about, so this is yesterday's numbers. Total deaths for the county are 22, ever hospitalized 118. We have 35 currently in the hospital, out of which 9 are in the ICU, 19 are male, and 16 are female, and the age group is given there. We also brought out early on there was a lot of concern about the percentage of healthcare workers that were positive, or the percentage of positive cases that were healthcare workers. We're seeing about 25%. So 75% of cases are from the community or from other places. This information shares the number over time. This is the same graph that we have been putting up on a daily basis that shows how the cases in total continue to climb. But what's helpful looking at this is how we get a breakdown over days. So if you look at this, this is the number of cases that we get per day. Starting with our first case we were reported on was the 11th of March, and this goes up until the 20th. As you'll see right around here, the 6th was the date the U Albany site was launched. We started getting results from that a couple of days later, which is why you see these higher numbers here. We have a couple of depressions here, which were times that the site was closed down, and then we're starting to see a little bit of a downward trend. Now, when we see this over a couple of days, it's a couple of days. We have to continue to follow it. In fact, this number from yesterday was we only had 5 positives, but from last night, we have an additional 22. So this data becomes more meaningful for us over time to let us know how COVID is spreading in the community and what the number of tests are. And as the county executive indicated, the more testing availability that we have, the better the data is. So we are still seeing pretty steady rates since the testing site was implemented. We've been getting between 20 and 30 positive cases most days. As I indicated yesterday, there has not been a spike, and nor have we seen a spike in hospitals. So we'll continue to follow this along. We've had a lot of people ask us about municipalities and how this is affecting particular municipalities. So this next data set is really designed to inform people that are interested in that. As you see, the data is represented by zip code, but it also talks about what municipality. So this is 12208. In Albany is 61. This is a hover capacity. So as you press on it, 12205, Albany 51. 12211, which I believe is also Manans, 45, and you can kind of go through this. We are seeing the vast preponderance, the highest numbers of cases in the 12203 area, where we have 81 cases, and in the 12208 area, where we have 61 cases. The way that this data is presented is the darker numbers. The darker shades indicate higher numbers. So you can go through that and get a better idea in terms of where this is. Now, what's important to note is that the data that we're representing here is as good as the data that we're getting from testing. So as we see testing availability increase in different areas, this may paint a different picture for us. So we look forward to continuing to follow that going forward. I think, as the county executive indicated, the data around age is revealing to us. But again, these are individuals who are tested positive. This does not necessarily represent disease severity of these individuals. It is just saying, of those tested and positive, this is the breakdown of age. We're seeing the highest number of positive cases in the 50 to 59-year-old age group. And we are seeing, as we've reported, cases in all decades of life. The 70 to 79 is not as prevalent as the 20 to 29. So this is important, or the 30 to 39, or the 40 to 49. So again, it stresses the importance that at all stages of life you are vulnerable to COVID-19. Looking at the race and ethnicity data, again, these results are based on our positives. So in Albany County, of the positives, 342, 52% are female, 318, 48% are male. This is reflective, again, of who's been tested. And when we look at the breakdown by race and ethnicity, 47% of the positive cases have ticked off white, 20% Black or African American. There are unknowns and there are others. Hispanics, 7%, and Asian or Pacific Islander is also 7%. Early on, when we started to get cases, there was not a clear way to collect racial and ethnic data, so that factors into this. But as we have gone forward, as forms have been changed, we have more robust ways to make sure that we get this data right. So this will be, as we go forward, again, more meaningful data. This is an important number. For Albany County, we have thus far tested 7,135 residents. So, as all of you know, in the county there are about 320,000 residents. So it's really a small percentage of the county that has thus far been tested. And of those who have been tested, about 9.6 have been positive. This number is for the 19th from the New York State COVID tracker, which we'll go to next. There were 103 persons tested on that day, and there were only 5 positives. This data has been updated on the New York State website and will be updated on this tomorrow. These additional resources are helpful. This is the state data tracker that has been put up by the New York State Department of Health. You can look at this map data and go to Albany County. If you look at Albany County, you again get that number that I just shared with you, and you can go for daily trends, which I think is a good graph to see. These are the people that are tested and the total people tested, positives and negatives. So you see the vast majority of people that are being tested are negative in Albany County. And for the date between April 19th and 20th, this was a particularly low number. Does this represent the start of a trend? We'll be following along to find out. So that is a start. Now, I want to say that data representation is a complex endeavor. We have worked with a partner on getting this data out called Live Stories, who we have previously worked with to get some of our opioid data represented to the county. This is an initial launch. We are hoping going forward to have more data, particularly data around morbidity, so we get an idea of those in the hospital, what are their racial and demographic breakdowns. So there will be more information coming from this, but this is the information that we have as of today, and we're happy to be able to share it with you.
Thank you, Dr. Whalen. And again, that's why we've been so aggressive with the testing, with the mobile sites that we've done in different communities, in the partnership with Rite Aid, and the partnership with the governor's office to get more testing done. I know you know they had testing done yesterday, just checking to see if people had it and they're out. That's going on a statewide level. So as this data continues to go on and we get more aggressive with testing, and that's what we're trying to do here in this county, to get that number higher so we can actually see where we're at. And that helps us make the decision when to open up, when to get back to businesses opening their doors and people back out in the community. So testing's the key, and we've been on top of it. And I want to thank my whole team. And this whole website design's been under the works for 5 weeks, but you can't put data out there when you don't have data to put out there. In the beginning, no one was tracking this. They weren't checking to see, any, males, females. They were just testing you to get you tested if you went in with signs and symptoms and had a fever. So we will change that, and we'll continue to change that as we go forward. So thank you to Dr. Whalen and her team and my team for making this happen. I can't thank you enough. And you can go to albanycounty.com and click on the coronavirus tab, in the data and statistics dashboard. We'll have that up there. And like Dr. Whalen said, it will be updated at the end of the day, that night, and we'll continue to update it. And again, don't hold us if for some reason it didn't get updated. We're doing our best that we can because everyone's been working around the clock. Also, the mental health hotline, as always, that I put out there, 7 days a week, 8 a.m. to 8 p.m. That number is area code 518-269-6634. As always, the 211 number in the New York State hotline. And again, my heart condolences and prayers goes out to the families of the 2 people we lost, and to the 25 families that we continue to think about you and pray for you. And it's not easy on any of us, and it's especially not easy on them families. So my condolences to them.